Assalamualaikum and hi everyone. Today me and my team want to present about infertility. So before we start, let's introduce ourselves first.
Hi, my name is Sofia Arisa binti Muhammad Ridwan.
Hi, my name is Nur Amira Sofia binti Syamsul Akmal.
Hello, my name is Nur Atira Sofia binti Cik.
Hello everyone, my name is Nur Umaira binti Abdul Rahman.
Did you know about infertility issues? Infertility is a disease characterized by the inability to achieve a successful pregnancy based on a patient's medical, sexual, and reproductive history, age, physical finding, diagnostic testing, or any combination of those factors. According to statistics, fertility problems affect around 10 to 15% of couples of reproductive age, which is 14 to 65 years old in Malaysia. The problem is reportedly becoming common over the years. Many couples do not seek professional help because of shame, stigma, or lack of resources. Some couples also resort to unproven or outdated methods to conceive, with no success. The World Health Organization (WHO) emphasized the need to address infertility issues before they cause permanent infertility.
So next, here shown the graph of fertility rate graph in Malaysia. From the graph, we can see that the fertility rate in Malaysia is decreasing from the year 1916 until the 2022.
Next, we move on to treatment and procedures of in vitro fertilization (IVF). What is in vitro fertilization? In vitro fertilization, also called IVF, is a complex series of procedures that can lead to a pregnancy. It is a treatment for infertility, a condition in which someone who can't get pregnant after at least a year of trying for most couples. IVF also can be used to prevent passing on genetic problems to a child. So here are the procedures of in vitro fertilization. The procedures of in vitro fertilization including preparation, ovarian stimulation, egg retrieval, fertilization, embryo development, embryo transfer, and pregnancy. Let's take a closure of in vitro fertilization procedure. So how does it work? Let's take a look step by step, look at the process. Step 1. Preparation. The IVF treatment process begins long before any egg removal and fertilization takes place. You will need a true medical history before treatment begins, plus fertility tests and analysis for you and your partner. As the procedure gets closer, you may be prescribed birth control pills or estrogen to control the timing of your menstrual cycle and maximize the number of mature eggs available for retrieval. Step 2. Ovarian stimulation. During a typical ovarian cycle, only one egg becomes mature enough to ovulate. IVF treatment uses injectable hormone medication to bring a group of eggs to maturity to increase the odds of a successful pregnancy. The type, the dosage, and frequency of the medication will be tailored specifically to you for optimal results. Monitoring of the eggs may occur daily or every few days during this time to determine when they mature. A final trigger shot is given exactly 36 hours before the scheduled egg retrieval to finalize the maturation process. Step 3. Egg retrieval. Once the eggs are mature, it's time for egg retrieval. During this step, a suction device connected to a long thin needle is inserted through your vagina. This will puncture ovarian follicles and pull the mature eggs out. Removed eggs are placed in a petri dish containing a special solution and then placed in an incubator for a short period of time. Since this procedure is mildly invasive, medication and sedation are used. Step 4. Fertilization. Fertilization of the eggs takes place within a day during a procedure known as an intracytoplasmic sperm injection. A single sperm is introduced into each mature egg. On average, about 70% of mature eggs will successfully fertilize. Step 5. Embryo development. Now comes the growing and waiting. Fertilized eggs are monitored and left to develop over the next several days with cells actively dividing. About half of fertilized embryos will progress to the blastocyst stage when they are suitable for transfer into a uterus. Embryos that are suitable for transfer can either be used right away or frozen for future transfer. Step 6. Embryo transfer. Within a week after fertilization, it's time to transfer the embryos. This is a short procedure that only takes about 10 minutes and feels very similar to a pelvic exam or a PET scan. A speculum is placed within the vagina, and a thin catheter is inserted through the cervix into the uterus. An embryo or embryos are then injected through the catheter into the uterus. After an embryo transfer, you may experience symptoms such as mild bloating and cramping, breast tenderness from high estrogen levels, spotting, and constipation. Step 7. Pregnancy. Within 14 days after the embryo transfer, a blood test will be done to determine if you are pregnant. If the pregnancy test is positive, you begin the journey of prenatal care. Pregnancy success rates per embryo transfer vary depending on the age of the woman at the time of egg retrieval. If the pregnancy test is negative, you can try another embryo transfer if you have additional embryos frozen from the first IVF cycle. If you do not have remaining embryos, you can try IVF again. IVF has been used successfully for more than 4 decades. Talk openly with your healthcare provider about your options.
So now we're moving on to fatwa regarding to the IVF treatment. The Islamic Fiqh Council issued the following fatwa in its 7th session held in 1404 Hijrah, taking a female seed and a male one from a man and a woman who are husband and wife, and doing an in vitro fertilization for the seeds before planting the resulting embryo in the womb of the wife from whom the egg was taken. Is in principle acceptable in Islam, but it can raise some doubts due to what accompanies it. So it should not be practiced unless there is dire necessity to do so and with some preconditions. So there are several conditions that allow IVF. So these conditions are as follows. First, the Muslim woman must not under any circumstances show her private parts to anybody except her husband. Second, the need for the woman to be treated for an illness is a lawful reason that gives her the right to be exposed to a person other than her husband, but this should be in conformity with the necessity itself. And the last one, if there is a legal reason for the woman to be exposed to a person other than her husband for treatment, that person should be a Muslim woman if there is one who can do the job.
For the conclusion, in vitro fertilization (IVF) is one of several techniques available to help people with fertility problems to have a baby. During IVF, an egg is removed from the woman's ovary and fertilized with sperm in a laboratory. The fertilized egg, called an embryo, is then returned to the woman's womb to grow and develop. It can be carried out using your eggs and your partner's sperm or eggs and sperm from donors. And lastly, this is the references that we use for this video. That's all from us. Thank you.